Good afternoon, everyone. Welcome to one more edition of Continual Educational Webinar Series conducted by Vijaya Diagnostic Center. First of all, I'd like to thank everyone who has joined us. Myself, Dr. Hatim, Senior Consultant Biochemist, Department of Biochemistry, Vijaya Diagnostic Center, Nagar Branch, Hyderabad. Uh, Today, we are presenting pre-analytical errors in clinical biochemistry. The topic presented today is Dr. C. Ramakrishna. He is consultant biochemist from Vijaya Diagnostic Center, Dwarka Nagar branch, Vizag. So, Dr. C. Ramakrishna, he has done his MD from Andhra Medical College, Visakhapatnam. He has many publications to his name. So, the topic, before going to the topic, I'd like to tell the people who are watching, they can type their queries if at all they have in the control panel or the comment box, so that we can take them at the end of the presentation. So without much further delay, I would like to ask Dr. C. Ramakrishna to start the presentation. So over to you, Dr. C. Ramakrishna.
Yeah, thank you, Hatim. First of all, welcome for today's webinar session on the behalf of Vijaya Diagnostic Center. The topic for today's webinar session is pre-analytical errors in clinical biochemistry. So what is the definition of pre-analytical error? It is the inappropriate performance before the specimens are measured by analyzers. It describes any variable whose value can affect the outcome of a subsequent analysis. So here you can see the normal specimen, the hemolyzed, the lipemic, and the icteric. So whenever you have an abnormal value, first look at the specimen, whether it is lysed, lipemic, or icteric. So coming first to the hemolysis sample, hemolysis is of two types. In vivo hemolysis, which occurs within the body, and it is due to decreased haptoglobin, and the presence of urine hemoglobin is very much diagnostic. Whereas in vitro hemolysis occurs outside the patient, right? So whenever the sample is collected improperly, then it leads to lysis, then it is called in vitro hemolysis. So the pre-analytical phase consists of blood sampling, sample handling, and delivery to the laboratory. So what are the mishaps that can occur while collecting a sample? The tourniquet is too tightly tied, and the needle is too thin, and the prick is given even before the alcohol swipe is dried up. Before drying, if you give the prick, then there is every chance of hemolysis. Next, the storage. Specimen should be stored at 2 to 8 degrees centigrade appropriately, right? And finally, over clenching of the fist also leads to abnormal values. So how does hemolysis interfere with the analysis of the specimen? First of all, there is spectrophotometric interference, and secondly, there is release of cell components into the sample, and also there is chemical interference. So spectrophotometer, all of you know the the working of a spectrophotometer, wherein there is a light source, and the light comes through the monochromator and through the slit and falls on the sample. So some of the light is absorbed. So the absorbed light is proportional to the concentration of the substance, right? So if the sample is lysed, there is discoloration of the sample, and the absorbed light will be different, and hence the concentration will also be variable. So what are the analytes which are altered during at the time of lysis? So increased levels are seen in ALT, AST, lactate dehydrogenase, lipase, potassium, creatinine, magnesium, urea, iron, phosphorus, and elevated protein. And decreased levels are seen in ALP, bilirubin, glucose, GGT, chloride, fibrinogen, albumin, sodium, and RBC. So this is the picture which shows the degree of hemolysis. If the degree of hemolysis is more than 200, then the sample needs to be rejected. So this is a real report, a real blood report of a patient. The name is not mentioned. So here you can see the parameters ALT, AST, bilirubin, all are in the negative range, right? So in this case, sample seems to be lyse, and the sample has to be repeated. Next, coming to lipemia. So lipemia is defined as turbidity of the sample visible to the naked eye. It causes light scattering due to the presence of large lipoprotein particles. The increase in concentration of lipoproteins in blood most commonly occurs due to postprandial triglyceride increase, parenteral lipid infusions, and also some lipid disorders. So again, what is the mechanism of interference caused by lipemia? Again, we have the spectrophotometric interference, interference caused by volume depletion effect, interference caused by partitioning of the sample, interference caused by physicochemical mechanisms. Here you can see the last aliquot, which is highly lipemic. So this is a graph depicting the lipemia and the parameters affected. So the green one is which is very much affected. So the parameters like calcium, chloride, magnesium, phosphorus, they seem to be very much affected due to lipemia. So icterus. So coming to the icterus, all of you know the level of bilirubin and how it affects the sample. So the normal level is up to 20 micromoles per liter, and the bilirubin concentration exceeds 34 micromoles per liter, there is a change in the color of the serum. If it is more than 100 micromoles per liter, then it is called as icterus. So icteric samples are usually received from intensive care units, gastroenterology centers, and pediatric clinics. So again, there is a spectrophotometric interference and chemical interference of bilirubin. So why bilirubin is important? Why lipemic sample leads to abnormal values? Because bilirubin interferes with enzymes, electrolytes, metabolites like urea, creatinine, glucose, lipids like cholesterol, triglycerides, proteins like albumin, total proteins, IgG, hormones, estradiol, beta HCG, and free T3, and some drugs like gentamicin, phenobarbital, theophylline, and tobramycin. So all these are affected by bilirubin. So again, this is another patient's report. So you can see the abnormal values: creatinine 8, sodium 113, potassium 3.6, ASC 207, ALP 226. So again, you need to correlate clinically. First, you need to look at the sample. So if it is icteric or any other abnormality, then you need to ask the history. If it doesn't correlate clinically and if the sample is icteric, then I'm afraid you need to ask for a repeat sample. So next, coming to tube additives. First of all, the heparin. Heparin interferes with numerous immunoassays by affecting the binding of antibody antigen and affecting the rate of reaction. So heparin plasma has been documented to cause significant negative bias in cardiac troponin. Sorry. Next, the EDTA, ethylene diamine tetraacetic acid. Commonly used additive, main action of EDTA is chelation of cations. So if EDTA is present in higher concentrations, its chelating activity is increased. So parameters like calcium, magnesium, potassium, chloride, and LD are dramatically biased by even a very modest EDTA contamination. Next, coagulation studies. It is very essential that the ratio of the sample to the citrate is maintained at 9:1. So if it's not maintained, then there is every chance of a clot being formed, and there is discharge of granules from the platelets, and it leads to abnormal coagulation studies. So here you can see the overfilled and the underfilled coagulation, the citrate tubes, the blue colored ones, and in both cases, the coagulation assay will be abnormal because the ratio of 9:1 is not maintained. Next, coming to the IV line contamination. So the laboratory may not catch every IV contaminated specimen. While IV lines collection of specimens through these lines can result in contamination of the specimen with the contents of the line. So if you go to the wards or the ICUs or the emergency units, you can see the patients with a drip. So whenever you collect a sample from the hand which has a drip, then there is every chance that the parameters, especially electrolytes, will become abnormal. In the bottom of the slide, you can see sodium 152, potassium 2.8. So potassium is clearly diluted and sodium is high. Okay, so it's very essential. You need to have presence of mind in taking sample from the opposite hand rather than the hand which has the IV line. Next, uh, most all the patients are prescribed with some medication. So medications also have an effect on the analytes, right? So especially creatinine. So creatinine is mostly affected by antibiotics like cephalosporins and drugs like acetaminophen, acetyl salicylic acid, which cause falsely increased creatinine levels. Then there is another drug called as leflunomide, which is an immunosuppressive drug, and it is used mostly in kidney transplant patients. And it shows abnormal or low calcium levels. So why? Because leflunomide after oral administration forms a metabolite teriflunomide, which causes falsely decreased ionized calcium concentrations. Then there is in neurosurgical units thiopental sodium, which is administered. It is used for the raised intracranial pressure. So thiopental causes abnormal sodium levels. Then we have the herbal medicines which cause direct interference with immunoassays due to cross reactivity. Due to their structural similarity, the tested analyte leads to or which reacts with the antibody in the assay, and based on the structure and design of the immunoassay result in both falsely elevated and decreased analyte concentrations. And finally, we have the contrast reagent gadolinium, which is a chelating agent, and it causes the interference mechanism and leads to the abnormal calcium levels. So next, coming to the HbA1c analysis. So HbA1c, all of you know, it is used for the glucose levels in the past 4 to 6 weeks. So inappropriately high HbA1c levels are seen in iron deficiency, vitamin B12 deficiency, alcoholism, uremia, hyperbilirubinemia, and drugs. And inappropriately low HbA1c levels are seen in hemolysis, acute blood loss, blood transfusion, hemoglobinopathies, chronic liver disease, and hypertriglyceridemia. Whereas variable effect is seen in fetal hemoglobin, methemoglobin, and certain hemoglobinopathies. So there are again drugs which affect the HbA1c levels. Drugs like dapsone, ribavirin, antiretrovirals, trimethoprim, sulfamethoxazole, all these cause increased erythrocyte destruction and causing abnormal HbA1c levels. And there are also drugs like hydroxyurea, vitamin C, vitamin E, and aspirin. These cause altered glycation, leading to falsely low HbA1c levels. And falsely high HbA1c levels are seen in aspirin and chronic opiate usage. And coming to the miscellaneous causes, uh, causes like water contamination, foreign bodies, prolonged time of transport for the sample, and blood transfusions. All these will lead to abnormal pre-analytic analysis. So, how to overcome all these abnormalities? So, most of them, 40 to 60%, will occur due to improper sample collection. So, it's all the simple things like when the tourniquet is tied, make sure it is not tied very tightly. So, the tightness should be average, and the needle should not be too small. And whenever you clean the local area with alcohol swipe, you need to wait for 30 to say 60 seconds for the alcohol to dry. Then only you need to give the prick. So that there will not be any lysis. And then we have this over clenching. Most of the old people, they tend to over clench their fist. So you need to make sure you need to request the patient not to clench the fist very tightly. And then transportation. The specimen, once collected, should come to the processing center within 1 hour, right? And storage, it needs to be stored appropriately in a temperature of 2 to 8 degrees centigrade after collection. Coming to the mixing of tubes. So it is very important that once the sample is collected, the tubes are mixed properly. So the various tubes are mixed in the very different times. Like for example, cultures and heparin and EDTA and fluoride tubes. All these tubes, they are mixed by overturning 8 to 10 times, whereas citrate is mixed 3 to 4 times and the gel tube is mixed 5 times. So again, some precautions for avoiding the pre-analytical errors. Usage of vacutainer is preferred over syringe. Avoid intermixing of sample from different vacutainers. Specimens should be collected from the arm opposite the line to avoid contamination. Specimens should not be collected distal to a catheter because fluids tend to pool in the periphery of the limb. Samples should be ideally transported to the laboratory immediately and at room temperature, but no later than within 1 hour of blood draw. Tube mixing is essential for the quality, and the tubes need to be mixed immediately after the blood is drawn to allow proper mixing of additive with blood and to prevent sample clotting. And the process of mixing, it should be 180 degrees inverting and then back to the upright position at least 8 times. Okay, so it needs to be properly mixed. So in summary, the various causes for pre-analytical errors may be because of lysis. The most common cause is a lysed sample, and then we have the lipemic and icteric samples. And there are various drugs like the antibiotics, the acetaminophen. All these drugs lead to abnormal creatinine levels. And then we have the herbal medicines which have structural similarity with the analytes. And then we have the contrast reagents like gadolinium and the immunosuppressive agents like leflunomide. So all these, they cause pre-analytical errors. And most importantly, you need to be very careful with the sample collection because most of the lysed samples are due to improper sample collection. Make sure the tourniquet is not tied too tightly, and make sure the alcohol which is applied to clean the local area is dried up before giving the prick. And then the needle, the size of the needle should not be too small, and transportation should be according to proper protocol and should reach the processing center within 1 hour. And storage of the sample needs to be, the temperature needs to be maintained at 2 to 8 degrees centigrade. And finally, clenching of the fist should be avoided. Okay, so that is for this today's session. I hope I was clear enough. It is a very small topic but very interesting, and it is very important because we get so many abnormal values and we don't know what to do. And if you just give a look at the sample, you can see clearly if it's lysed, icteric, or lipemic, right? So that is very important. And thank you very much for your patient listening. And I thank the committee from the Vijaya Diagnostic Center for giving me this opportunity. And thank you very much. And if you have any doubts, you can raise. Yeah, thank you.
Thank you, Dr. Ramakrishna. So, as you said, the most neglected or most important topic it is. So, many times we get very much abnormal values. We try to find out other causes, but the most important and the first cause should be like Are there any pre-analytical errors? So as you said, so that was a very important and short discussion. I hope it was very useful for everyone. I think we have some queries here. So one of this is, tell us about the mixing of tubes after sample collection.
Yeah, so that is very important because the sample needs to be mixed with the additives, and this should be done immediately after taking the sample, right? And it should be done according to the type of sample collected. Like, for example, the fluoride, it should be mixed 8 to 10 times, and the mixing should be it should be inverted 180 degrees and then back to the upright position 8 to 10 times. So that is called as proper mixing. And similarly for blood cultures, it is 8 to 10 times. And for gel tubes, it is 3 to 5 times. So that is about the mixing aspect, and it is very essential because the additives and the sample needs to be properly mixed, especially for the coagulation studies and all the various samples.
Okay. We have one more query, that is, which drug or medication commonly affects the analysis?
Yeah, we today we see so many patients with so many clinics coming up, and so many doctors prescribe unnecessary antibiotics, right? So, which is I find is very unethical, but unethical and dangerous because most of the antibiotics like cephalosporins and the NSAIDs, if they are used improperly or overusage, they lead to abnormal creatinine levels. So you need to stick to a good general physician or a GP to get the correct dosage of and the correct selection of antibiotic.
Okay. One more, why should we, the Icteric sample be rejected?
Well, because the Icteric sample obviously has high bilirubin content, and as we have seen in the previous slide, bilirubin interferes with various electrolytes, enzymes, and all these parameters. So it's very essential that whenever you get an Icteric sample, first you correlate clinically.
Okay.
So if it's correlating clinically, then uh, if it's not relating clinically, then there is some interference with the bilirubin, and the sample may be or should be rejected.
Okay. Thank you. So that's it. I don't think we have any more queries. Thank you, Dr. Ramakrishna, for the presentation. And that's all from Vijaya Diagnostic Center webinar series. Hope we see you in the next session. Thank you. Thank you, everyone.
Thank you so much. Thank you.